So, doctor, you told about what to eat, what not to eat, how to exercise, how to keep yourself healthy, maybe take up a hobby, all of this. But one thing, if you have to say, that is must for anybody of across age groups to keep your heart healthy, what would that be?
Sleep adequately. See that you sleep 7 to 8 hours, good sleep. That is very important to maintain health and heart to prevent heart disease. So nowadays with this night duties and abnormal working hours, there is a lot of sleep disturbance.
Yes.
So adequate sleep is very important to maintain heart health also.
So, Dr. Ashwin, one moment that you spent with your patient which changed the way you look at heart, anything that you can share with us?
Yeah, during my initial practice days, I came across a patient of 17 years old. He was a student. So evening when I was going back home from the duty, he came. He had a severe chest pain. So on evaluation, he had a massive heart attack. So we were all shocked because 17 years, innocent boy getting into severe heart attack was not that common. So we admitted him, we treated him, we had to do angiogram, and there was a lot of thrombus in his main artery supplying the heart. So we gave injections to dissolve the clot, and he was all right. Then we went back and took detailed history, what went wrong. So the day morning when he came to the hospital, he had an entrance MSET exam.
Okay.
So stress of that exam, and then he had to study again for the next day.
Long
so
night
lot
out.
of stress. There is no diabetes in him. There is no hypertension. He had no smoking habit. In spite of that, getting into such severe heart attack in a young age. So since then, the importance of lifestyle modification and managing stress, we started to
So
give.
ultimately, everything is
that
boiling down to stress.
Stress.
We have to handle stress,
Yeah.
and if you can handle stress, that will lead to a healthy and happy heart.
Yeah. So patients, they present sometimes very subtle symptoms. So we need to advise or give knowledge to the society that don't ignore any symptoms.
Yes.
They can be a typical presentation. They can be a typical chest pain, some uneasiness, sweating, or palpitations. So consult your doctor. Don't self-diagnose and delay the problem.
So ultimately, what you're saying, doctor, is stress. If stress is in control, you have a healthy heart.
Yeah.
So one last question that I would like to ask is, what is the difference between heart attack and heart arrest?
This is the common question asked so many times. Heart attack is a situation where you have blockages in the arteries supplying heart. So sudden block of the blood supply to the heart presents as a heart attack. But the complication, the end result of heart attack can be heart arrest. Cardiac arrest is a situation where the heart as a pump fails. So it stops beating, there is no rhythm, and then we have to revive the patient. So that is a life-threatening situation. So if the patient is at home and the periphery is not able to reach hospital in time and he had an arrest, is not a good situation. So any patient having chest pain, breathlessness, shortness of breath, sweating, palpitation should reach hospital in time without wasting. This is called golden hour. So is very important. So heart attack is coronary artery disease blockage, whereas heart arrest is the cardiac function is stopped. So pumping is stopped. There we have to give him cardiorespiratory resuscitation and save his life. Sometimes they need shock. We need give DC shock to restore the rhythm.
Yes.
So when the patient reaches the hospital, the arrested patient has no rhythm. There is no breathing. So we have to connect him to ventilator, give a shock, and then save. So many patients come with such grave situation. We have to save their life.
Okay. Morning walk or gym?
Morning walk, because it is more superior, sustainable, long term, and then it also focus on mental as well as physical health.
Ghee, is it an enemy or a friend?
When consumed in limited quantity, it is a friend. When consumed excess, it is an enemy.
Heart checkup age, everybody should remember.
30 years.
Biggest red flag that people ignore.
People ignore subtle signs of heart disease. They may not have typical chest pain or shortness of breath. Even fatigability, that is easy tiredness or swelling in the legs or some kind of uneasiness, restlessness also is important. So we need to identify such symptoms and reach the doctor as early as possible before getting into complications and risk. So don't take your own decision, don't self-diagnose.
Don't be Google doctors.
Yeah, Google. So that is important. Because most 50%, more than 50% of heart disease they are silent and they are atypical presentation. So we need to identify and treat them properly in early stage to prevent complications.
So before I conclude, what is that one message that you would like to give in short answer?
So as I told you, the heart damage is slow and silent because of sugars, salt, poor sleep, stress, and long sitting hours. So you take adequate sleep, avoid long sitting, do regular exercise, eat healthy food, and most important is learn to avoid stress and manage stress. So because lifestyle modification is important, medicines save you for a day, but habits save you for life. So that is my message, and wish you all a healthy heart life.
Thank you so much. So I think in a simple word, medicines will just save a day, but good heart and stressless life is what will keep you going. So good luck on that, and see you again with another doctor next episode.